In this video, let's talk just a little bit about how we close surgical wounds and what are some things that you should know about how your wound is closed. There's all kinds of different suture that is used to close wounds. Well, there's really two different ways to classify a suture. One is, does it absorb or does it not absorb? The other is it a braided polyfilament or is it a monofilament? When we close wounds, we usually use a deeper suture under the skin that is braided and absorbs. And it absorbs over the course of a few weeks. So let's say we're doing a lumbar fusion or maybe we're doing a cervical disc replacement. There's some layers under the skin that we close with absorbable suture. And again, the time frame for the absorption is a few weeks. On the skin itself, we have the option of a monofilament suture that absorbs, a monofilament suture that does not absorb and needs to be removed, staples, or skin glue. I like skin glue because it doesn't have to be removed. You don't need a dressing, and you can shower with it because it blocks water from coming in. Probably shouldn't soak underwater though for a few weeks. Staples are nice because they're efficient, they're easy to remove, and are really good especially for the scalp and doing a craniotomy. The monocryl suture is a thin little fishing line-like suture that you might see that we will sometimes use to help close a wound, especially in the back of the neck and on the head. It absorbs over the course of a few weeks. And then sometimes we'll use a suture that's a black, usually nylon suture that does need to be removed because it doesn't absorb. So again, most of the closure for the skin is done with glue. So what does this mean for you? Well, if you've had surgery, know that what you see on the surface is not the only thing that we've done to close the wound. There are sutures that are deep to the wound. Your body, though, has to heal because those sutures absorb. So good nutrition, some time and patience to allow the underneath layers to fully heal. On the surface, again, we usually use skin glue, sometimes staples, sometimes monocryl, rarely nylon. Most of the time there's nothing to remove, but if you do have something to remove, we will let you know. If it staples, then definitely about 2 weeks after surgery, we would remove the staples.